Now I'm going to ask Mr. Segone to take the floor for a second time to present the evaluation on the UNFPA response to the Syria crisis. Mr. Segone, you have the floor again.
Thank you very much, Madam President. So, Madam President, distinguished member of the Executive Board, it is my pleasure to present now the main results of the evaluation of the UNFPA response to the Syria crisis. The purpose of this evaluation was to assess the contribution of UNFPA to the Syrian humanitarian crisis response while generating findings and lessons learned that would be of value across UNFPA and stakeholders. Covering the period 2011-2018, the evaluation assessed all UNFPA-supported humanitarian interventions targeting affected population within Syria as well as in neighboring countries. Madam President, distinguished delegates, please allow me to present the key conclusion of the evaluation. Despite a slow start, the UNFPA response to the Syria humanitarian crisis has been appropriate to the needs of affected population over time, with priority to the hardest to reach population. Overall, UNFPA has been more effective at provision of response services than prevention, both in the field of sexual and reproductive health and in the field of gender-based violence. The UNFPA gender-based violence response within the framework of the whole of Syria approach has been exceptionally good, thanks to the high-quality products developed by the UNFPA Regional Response Hub, such as Voices and the Gender-Based Violence Dashboard. However, the inconsistency of inclusion of men and boys in gender-based violence programming across country offices has impeded the ability of UNFPA to fully exercise its leadership in this area. The UNFPA Regional Response Hub has generated high returns on investments in terms of 1. Mobilizing significant multi-year funding, 2. Advocacy and representation at whole of Syria strategic steering group level, thus increasing the credibility of UNFPA as a humanitarian actor, 3. Raising the profile of GBV as a life-saving intervention, and 4. Coordination for the whole of Syria approach. However, UNFPA has not adequately reviewed and revised where necessary the role and function of the hub in line with the increasing capacity of country offices. Finally, the evaluation found that UNFPA operational and financial system and structure have not fully supported the effectiveness of the response to the Syria crisis. The increasing reliance of country offices on other resources, less flexible than regular resources, has impaired their responsiveness to a rapidly evolving crisis. The lack of flexibility in UNFPA's system and structure has also led country offices to make inconsistent use of fast-track procedures, surge and emergency commodities. Madam President, distinguished delegates, please allow me to turn to the recommendations of the evaluation. The evaluation made 7 recommendations for UNFPA's Syria response. First, UNFPA is recommended to recognize the current limitation with monitoring and utilize its expertise in population dynamics to contextualize result data. Second, UNFPA should review the function of the Syria Regional Response Hub in light of changing circumstances and agreeing the future role of the Regional Response Hub. Third, UNFPA is invited to clarify and ensure consistency in its position of the inclusion of men and boys in gender-based violence programming within the regional response and ensure organizational consistency in gender-based violence language and programming in relation to the inclusion of men and boys. Fourth, UNFPA should review the use of fast-track procedures, surge and emergency commodities and continue advocating with member states and donors for an adequate level of regular resources to increase the efficiency of the Syria regional response. Fifth, UNFPA should recognize the vacuum around youth leadership and step up youth programming and coordination across the Syria regional response. Sixth, UNFPA should resource and support sexual and reproductive health and rights coordination within the Syria regional response to the same level as gender-based violence coordination. And seventh, UNFPA should increase documentation of gender analysis and adherence to international humanitarian principles in the Syria regional response. 2 additional recommendations were made for UNFPA globally. First, UNFPA should use the whole of Syria gender-based violence subcluster as a blueprint for UNFPA coordination responsibilities globally. And second, UNFPA should use the Evaluation Regional Response Hub case study together with a further rapid appraisal of the effectiveness of hub mechanisms of other agencies to develop a blueprint for the establishment of other potential hubs in future. Madam President, distinguished delegates, after 8 years of conflict, more than 13 million Syrians are still in need of humanitarian assistance. The commitment of UNFPA management to learn from and act upon the recommendation of this evaluation should help to enhance further the response that UNFPA provides to those most in need. This concludes my presentation, Madam President. I thank you and the Executive Board for the continued support and guidance, and I'm at your disposal for any question and clarification. Thank you.
Thank you very much, Mr. Segone. And I'm now giving the floor to Mr. Wordofa again for the management response to that evaluation on the Syria crisis. Thank you.
Thank you, Madam President. Again, Your Excellencies and distinguished delegates, it's my pleasure to present the management response to the findings and recommendation of the evaluation of UNFPA response to the Syrian crisis. UNFPA finds the report substantive, relevant and timely. We have already made progress on many issues raised in the report, and we will continue pursuing priorities as outlined in our response posted on the Executive Board page. In response to Recommendation 1, a series of specific actions were taken to overcome limitations with monitoring, including gaps in data management. In particular, the Regional Syria Response Hub has developed a tool for capturing gender-based violence data. In addition, UNFPA is currently piloting a dashboard for reproductive health data. Our team is developing a global humanitarian resource for utilizing population data to support humanitarian activities across whole of Syria and the neighboring countries with Syrian refugees. And we will continue our engagement with the United Nations Office for Coordination of Humanitarian Affairs, OCHA, and with the International Organization for Migration, IOM, to expand the use of population dynamics data in that regard. We noted in the recommendation too that the Syria Regional Response Hub has a high return on investment in relation to resource mobilization, coordination and management of gender-based violence data. To address the need to review the functions of Syria Regional Response Hub and to better align with increased capacity of country offices, UNFPA has revised the terms of reference for the hub. The hub will continue functioning in line with the United Nations Security Council Resolution 2165, and the further revisions of its function will be informed by the evolving dynamics of the regional crisis and new resolutions of the Security Council. Our management has partially accepted the need to clarify UNFPA position on gender-based violence vis-à-vis men and boys. As stated in Recommendation 3, UNFPA has already developed a gender strategy which articulates that UNFPA follows the definition of gender-based violence as per General Recommendation 35 of the Convention on the Elimination of All Forms of Discrimination Against Women. The Fund strongly agreed that programming for men and boys is a requirement in any gender-based violence response. However, we would like to note the cost implication associated with programming to adequately and appropriately respond to the needs of sexual violence, specifically for male survivors. Such funds are currently not available at UNFPA. Thorough analysis is required to assess the financial gap. Given that UNFPA has less than 50% of funds required for humanitarian work, we must prioritize the needs and the areas of response in this regard. In response to Recommendation number 4, to increase the efficiency of Syrian regional response, UNFPA is currently reviewing the fast-track procedure, including those for human resources, and has already updated some of them. We have systematized and specifically improved the surge response, reducing turnaround times. However, deployment is still affected by lengthy process of obtaining visas, which is beyond our control. Going forward, the fund will synthesize country offices to comply with surge standard operating procedures following the interagency standing committee scale-up protocols. This will further ensure coherence with the humanitarian agencies. As per recommendation number 5 on stepping up youth programming and coordination across Syria regional response, UNFPA will use phased approach to roll out the compact for young people. We are ready to lead on the compact and on Security Council Resolution 2250 by developing a youth in emergencies program, noting that implementation will require support from donors and expanded engagement with partners. As for recommendation number 6 on resourcing and supporting sexual and reproductive health and rights coordination within the Syria regional response to the same level as gender-based violence coordination, UNFPA has only partially accepted. We wish to emphasize that currently UNFPA is the lead of the gender-based violence area of responsibility of the Global Protection Cluster. We closely collaborate with the World Health Organization, the Health Cluster Lead Agency, and other agencies to address sexual and reproductive health needs in emergencies. However, UNFPA has not been assigned a leading role in sexual and reproductive health coordination. Furthermore, UNFPA needs more funding to adequately support sexual and reproductive health in humanitarian crisis. Meanwhile, UNFPA incorporates basic sexual and reproductive health services in all gender-based violence support. In addition, in the case of Syria Regional Response Hub, the decision was made that it would be more efficient and effective to utilize the funds for sexual and reproductive health support at a country level and not through the hub. We accept recommendation number 7 to increase documentation of gender analysis and adherence to the international humanitarian principles, international humanitarian law, international human rights law, and the international refugee law in Syria regional response. We will do the necessary steps to ensure it is implementation. As emphasized in recommendation number 8 and 9, UNFPA is proud that the evaluation recognized and recommended the Syria gender-based violence subcluster coordination mechanisms to be a blueprint for coordination responsibilities globally. UNFPA is fully committed to leverage further the best practices of the Syria Regional Response Hub to improve refugee response in other regional and country offices. We will use the Syria Regional Response Hub case study report and the experience of other agencies' regional hubs to develop a blueprint for the establishment of regional hubs in the future. Let me conclude my remarks by expressing thanks to the Evaluation Office for the good work done in analyzing UNFPA's leadership role across the gender-based violence, sexual and reproductive health and rights and youth across whole of Syria and the neighboring countries within the Syria refugees. I would like to assure you that the management is fully committed to fully implement the evaluation recommendations. Thank you.
Thank you very much, Mr. Wordofa. That was the management response. And I would now like to give the floor to the Regional Director for the Arab States region, Mr. Louai, I have to put on my glasses, Shabanaye, to make some remarks, particularly on the Syrian crisis evaluation. Thank you.
Thank you very much, Madam Chair. I just would like to complement some context information about the evaluation and the response that has been made by Mr. Dereje. The first one on the uniqueness of this evaluation. This is an independent evaluation that has a unique exercise for us in the Arab State region. And I am sure of our organization in general will benefit from that. Being first the biggest and the most far-reaching humanitarian response by UNFPA, the impact of which surpassed national boundaries across many countries in the region: Egypt, Iraq, Jordan, Lebanon, and Turkey. The second point is related on the program response, as the findings of the evaluation has shown UNFPA at all levels, regional office, country office, and headquarters, worked in harmony with all partners to provide life-saving reproductive, maternal health and family planning services, GBV prevention services, and support the survivors of violence and others. The third issue is related to the evaluation context and complexity. As you may already know, the exercise covers our response to the crisis between 2011 and 2018, including our cross-border operations, all in the framework of the whole of Syria approach, 3RP, Regional Refugee Response Plan, that harmonized protection and assistance to refugees, including from neighboring countries. It analyzed the organizational structures set up to coordinate the interventions and contributions of the Amman-based UNFPA Regional Response Hub. I am mentioning all this to show the complexity of delivering life-saving humanitarian assistance to those affected by the Syria crisis across the region. I believe the finding, recommendations, and our management response, as presented by Mr. Dereje, to the evaluation will need to be viewed with this mind. Finally, as far the actions of management response is concerned, I will put particular emphasis on the importance of this evaluation. I asked my colleagues in our regional and country office to work closely with other units to articulate a series of actions in order to bring the changes in support of our ongoing efforts to improve our business practices in the region. As the conflict has entered into its 9th year in Syria, more than 11.7 million Syrians are still in need for humanitarian support and protection needs. With the leadership of our senior management at headquarter level, I will continue to work with my colleagues in the regional office and the country offices to ensure we implement all the actions required for a more effective and efficient delivery of life-saving interventions to the people we serve. Thank you very much.
Thank you very much, Mr. Shabanaye. That concludes the remarks then from the podium. So I now plan to open the floor to delegations. We don't have a pre-subscribed list, so if any delegation wishes to take the floor, I ask you to indicate in the usual manner by pressing your microphones. We don't actually have anyone on the list. I see, yeah, but I can't see who the speaker is. Switzerland, you have the floor, delegation of Switzerland.
Madam President, I have the honor to make this statement on behalf of Albania, Australia, Austria, Belgium, Canada, Finland, France, Germany, Iceland, Ireland, Israel, Italy, Japan, Republic of Korea, Luxembourg, Mexico, the Kingdom of the Netherlands, New Zealand, Norway, Sweden, Turkey, Ukraine, the United Kingdom, and my own country, Switzerland. We thank the Evaluation Office for its annual report. The clear, well-structured, and easy-to-read report in front of us is a valuable instrument allowing member states to easily follow developments of UNFPA's evaluation function. Madam President, in this intervention, we would like to highlight some elements that are of particular importance to us. First, on performance, resource allocation, and learning. We congratulate the Evaluation Office and are pleased to comment on an overall very positive picture of UNFPA's evaluation performance. We are particularly pleased with the significant improvement of coverage and implementation rate of decentralized program level evaluations. Past financial constraints are being addressed successfully by a cooperation of the Evaluation Office and the Policy and Strategy Division, notably through the financial ring-fencing mechanism benefiting in particular small country offices. We value and request to continue these efforts. Accordingly, financial investment in the evaluation function has increased in the last year, even more for decentralized evaluations. With an annual expenditure of 0.96%, we are getting closer to the 1.4 to 3% of total program expenditure as defined target in the renewed evaluation policy. We look forward and anticipate to see this trend continue. As the quality of the evaluations in 2018 deviate from the positive trend observed in the last years, we encourage the Evaluation Office to make efforts to prevent a potential negative trend. The quality of the evaluations must be safeguarded, including by monitoring any potential continuing decline of the percentage of program-level evaluations rated good or very good. Furthermore, we are pleased that implementation of recommendations by management continues to increase. We believe this is a key element to ensure that evaluation findings lead to learning. In this sense, we also welcome the introduction of the new key performance indicator on the use of evaluation in program development. As mentioned in the report, support for better use of evaluation findings is needed. Therefore, we also encourage the Evaluation Office to finalize in 2019
Okay, I'm afraid you have outrun your allocated time, Switzerland. So our next speaker is Canada. You need to watch the time.
We'll try. Thank you, Madam President, for letting me take the floor. My quick intervention is just on the evaluation of UNFPA's response to the Syrian crisis. Canada would just like to note that we really appreciate the transparency of the evaluation and the importance of UNFPA's work in this region that provides critical life-saving services, particularly for women and girls. We support the evaluation's recommendations and encourage UNFPA to continue to focus on its attention on strengthening programming for youth, particularly adolescent girls that frequently are not a focus of humanitarian responses. We also strongly support the evaluation recommendation to ensure that all of UNFPA's humanitarian programming and advocacy is grounded in a comprehensive gender and inclusion analysis, noting that the inclusion of communities such as the LGBTI community will require, programming in the area will require and need to be accompanied by a comprehensive risk analysis and risk mitigation strategies. And just a quick question as follow-up. We've heard mention of the corporate gender strategy that's going to be available. I'm just wondering when it's actually going to be presented or made available to the executive board. Thank you.
Thank you, Canada. Your question is being noted here and you stayed within the time. Finland, you have the floor.
Thank you, Madam President. Finland thanks the Evaluation Office for the evaluation of the UNFPA response to the Syria crisis and UNFPA for the management response. Overall, we welcome UNFPA's strengthened engagement and leadership in humanitarian settings, coordinating interventions for sexual and reproductive health and gender-based violence. We highly appreciate UNFPA's important work in Syria and the neighboring countries, and we will continue to support UNFPA in this work in 2019. We welcome and support the positive findings of the evaluation and note the areas for improvement and the recommendations. And in particular, we'd like to emphasize the need to address inconsistencies in gender and inclusion analysis and the limited focus on or investment in persons with disabilities. And in this regard, we appreciate UNFPA's commitment and plans for action outlined in the management response. Thank you.
Thank you, Finland. So that's actually the end of the list here as far as I can see. Is there any other delegation who wishes to take the floor? Speak now, forever be silent. Okay. So I'm going to offer the floor now to the Evaluation Office and Management of UNFPA to respond. I'll turn to Mr. Segone in the first instance. You have the floor, Mr. Segone.
Thank you very much, Madam President. And thanks a lot to all the distinguished delegates who took the floor, including with joint statements. And thanks a lot for the word of appreciations, both on the report as well as on the progress of the evaluation function. We are also taking notes your feedback, and notably the two points that I took note is really in continuing to monitor the quality of evaluation reports. So I really would like to ensure you that the Evaluation Office in cooperation with the Program and Strategy Division will continue, and with the regional monitoring and evaluation advisors, will continue to ensure the quality assurance of the evaluation reports. Mainly, we are talking about the decentralized evaluation reports. So remain ensure that we will pay particular attention on these aspects. And when the second item was about the communication strategy, I have the pleasure to report that the evaluation strategy is finalized now, and we are just finalizing the user-friendly presentation of the strategy, and it will be launched in few days or next week. So, but we will definitely report back to the board, not only on the launch, but actually on the implementation of the strategy that will start happening this year, and we will report back in the next annual report.
Thank you very much, Mr. Segone. And Mr. Wordofa will take the floor just briefly.
Just briefly, on the comment regarding the use of evaluation findings and recommendations, we try to emphasize, with this morning and also this afternoon, that we have rolled out the knowledge management systems where we capture learning as we implement, but also from findings of evaluations. And this is incorporated in programs that we design, program policies in particular that we put together, and to any direction that we put in place. And one of the key indicators is 80% of our evaluation findings are incorporated in new country program developments. Regarding the Canada comment, including young people, especially adolescents, into the humanitarian work, there are 4 focus areas in our humanitarian work. One is sexual reproductive health and making sure that women do not die while giving, birth or during pregnancy. Gender area of responsibility, which we discussed extensively, data, and the 4th is youth. So within that, adolescent, would be, central. In terms of the gender strategy, this is under scrutiny, and we don't know a specific date to let you know at this point in time. But we will communicate when it's ready. Hopefully, it is in this year. Finland, in terms of inclusion, gender, those who are living with disabilities, including not only physical disabilities, but also mental health. This will remain an important focus areas for us as overarching strategy to include whatever programs we do in humanitarian crisis. That dimension is fully mainstreamed. Thank you.
Thank you very much, Mr. Wordofa. Is there anyone else who needs to respond? No. I'm looking down at our Swiss colleague. I know that she's not very happy about her microphone being cut off, and I understand that. The rule that we instituted is 3 minutes for individual statements, 5 minutes for groups. I'm told by the Secretariat that you did indeed have 5 minutes. It may not make a lot of sense at times that we do this, but frankly, in our last sessions in the Bureau, we had a long discussion about the fact that many delegations felt they didn't get an opportunity to speak. So I'm bound by the rules, but I just want to reassure the Swiss delegates you're speaking for a very large number of member states, that it will be up on paper, smart your remarks, and that colleagues will have an opportunity to consult them there. So thank you for your understanding. So before I close the meeting, as we don't have any more speakers, I'm going to give the floor to Mr. Horst Roach, Officer in charge of the Executive Board branch of UNFPA, to make a few announcements.